Today, I'm honored to welcome Dr. Thomas Phelan to Mental Health Without Borders, the Global Wellness Podcast with Dr. Lindsay Frey. Dr. Phelan is a renowned clinical psychologist, educator, and author, best known for his groundbreaking work in child behavior management through his widely acclaimed 1-2-3 Magic series. Over the past decade, his practical parenting principles have helped countless families foster healthier, more peaceful homes. More recently, Dr. Phelan has turned his attention to a condition that deeply impacts emotional well-being, but remains less understood: misophonia. His insightful book, The Sound and the Fury: Understanding and Managing Misophonia in Adults and Children, offers hope and guidance to those struggling with this challenging disorder. It is truly a joy and an honor to have Dr. Phelan here with us today to share his expertise and passion for improving mental health across borders. So Dr. Phelan, thank you so much for joining us today on this episode. To start, can you please introduce yourself, share a bit about your clinical work, and tell us why these subjects are so important to you?
I will. Thank you, Lindsay. Yeah, I'm a clinical psychologist by trade. And years ago, when I got out of graduate school, just by chance, one of the women in my clinical psychology class, turns out she became the wife of a pediatrician. And the pediatrician started referring people to me. And these are, of course, little kids. And I hadn't really specialized that much in different things. I'm getting all these children referrals that they won't go to bed, they're fighting too much, they don't do their homework, all this kind of thing. I'm flying by the seat of my pants. I was forced by this whole thing. I had to serve the doctors, the families, the kids. And I had to come up with some practical ways of dealing with these very simple problems. And I did.
And so you started that really early in your work then?
I did, yeah. And I can remember one of the foundations of 1-2-3 Magic. We tell people it's the only parenting program based on the fact that parents talk too much. That's really a strange notion because parents do talk too much and they don't realize. I can remember the mom I was talking to, and she was talking so much that she was irritating me. She had a 10-year-old son she'd brought in, and I thought, wait a minute, if she's irritating me, she's probably irritating this little boy. If she's irritating this little boy, what are the chances of his cooperating with her? They're not good. Fundamental insight underlies the whole program.
Yeah, I agree. And don't you feel like they missed the mark? So whatever that message is that they're saying gets completely lost in all the words.
It is. And, the message is, would you please drink your milk? Or would you please go to bed? Or would you please do your homework? And that message is not, let's have an argument. But you trigger that other verbal, when you talk back so much, you trigger that other verbal part of the brain. You want to talk parts of the brain. There's a speaking part of the brain that you're triggering. You want to trigger the behavior part of the brain, not the speaking part.
Yes, absolutely. And in my clinical work, I've worked with children and adolescents the entirety of my career. So around 15 years since I started with my master's degree, I've been using this program over and over and over again, the families that I work with and then the families around me. And I have told you personally that I've also used the entire system with my son from 2 to now, who's 12 years old as well. So even at 12, he rarely gets in trouble. I tell people this because I started so young that now if he gets an attitude, I just say, buddy, that's a 1. And he whips his head around so surprised because he knows exactly what's happening and his behavior changes. So it really is. I tell them, the families, it is like magic. Once you start using it and you're consistent with it, then you will start to see the behavior change because you're tightening the boundaries and they see that you're serious.
Right. And, parents these days are exhausted. You get moms like you, so you're working outside the home, you're working inside the home. And usually the moms inside the home are doing way more than the dads inside the home are doing. Parents are exhausted. Our country has never heard of discipline efficiency. You don't have time to spend half hour. You don't have that time to spend disciplining your kids, getting them to bed and all this kind of stuff. You need something that works gently and quickly. And the way you described it is a perfect way to describe it.
And for people who don't know, it's become a staple for a lot of families, but what is the central philosophy? Because you and I are talking about it because we both know kind of the central philosophy of it. But if someone hasn't heard of it, what do you mean by 1-2-3 Magic?
Yeah. 1-2-3 has 2 meanings. And the first meaning is that there are 3 parenting jobs. And you do these 3 jobs, you'll be a pretty good parent. Your first job is to control obnoxious behavior, arguing, yelling, whining, fighting, teasing, screaming, and all that. For that, we use the signaling, which right now is 1-2-3. You say that's one if the child's acting up, and a two in 5 seconds if they don't stop. The second parenting job is encouraging positive behavior, like going to bed, doing your homework, getting up and out in the morning, and so on. And for that, we establish routines with the kids. Kids love routines. I mean, that sounds funny, but they do, and they do well. And that, again, is a discipline efficient thing for parents. And your third parenting job is bonding. Not really a discipline job so much, but making sure that you have a good one-on-one with your kids. And my absolute favorite thing for bonding is what I call dyadic delight. It's one parent and one kid at the same time enjoying the same thing. I'm going to sound sacrilegious what I'm going to say next. Family fun is way overrated. And the reason family fun is way overrated is because that there are multiple agendas. The biggest thing, though, is sibling rivalry. Big fact of life. Kids age 4 to 7 fight 3 to 4 times an hour. But you want to bond with your kids and you want to bond with your spouse. That's dyadic joy. You need just two people. So anyway, those are the three parenting jobs. The other meaning of the 1, 2, 3 is the 1, 2, 3, the signaling that we use for obnoxious behavior.
And I think you bring up a really important point. That one-on-one relationship is crucial, I think, for parents and for their kiddos. And we don't think about that quite enough. Just developing that independent relationship with them. I like to kind of invite them into the child's world as well. So many parents are focused on the things they want to do versus getting down and just playing with Legos. And some of the thing I talk about in my parenting training is it's the quality of time, not the quantity of time. So if you did that for 20 minutes before bed with your kiddo, before they started their routine, just the joy that would bring them, that you got on the floor and built, a small Lego with them. That's a memory.
It does. You're absolutely right. It's get down on the floor and meet them at their level. But, one of the benefits of that is, and I found this with both our kids and the grandkids, is then you get to relive some of the stuff. I used to watch SpongeBob with the grandkids, and that's a really stupid thing. We had the greatest time watching SpongeBob. You do stuff that you wouldn't do otherwise.
Mm-hmm. Yes, absolutely. Bring that just childhood joy back to you as well when life is just so busy and hectic and heavy sometimes. And so can you explain the difference between start and stop behaviors and why that distinction matters?
Yes. The first parenting job is about obnoxious behavior, which we call stop behavior, because you want them to stop it. And the biggest thing parents want kids to stop is whining. Whining is the number one on the list. So when we want them to stop it, we're going to use the signaling, very gentle, as opposed to the opposite, which is the start behavior, which is the positive behavior. That's parenting job number 2, which is getting up and out in the morning, going to bed, being kind to other people, doing your homework, eating your dinner, and those kinds of things. And the reason we distinguish between the start and the stop behavior is because they're different tactics. So we're going to use the signaling for the stop or obnoxious behavior, and we're going to use the routines for the start or the positive behavior. And that, again, gets back to that discipline efficiency thing. So the kid's whining, what are you going to do? You want to start and give a lecture on why you shouldn't whine? No, you just signal. They know why they shouldn't whine. They don't need another lecture.
Right. And I'm going to ask you a question I already know the answer to, but throughout all the years of giving this resource, in the back of my mind, I've always wanted to know what you would say, because I know what I say to the parents. What would you say to a parent who rewards their child for poor behavior? So I want you to come into the therapy session. They whine, they cry, they have this negative behavior. I'll give you a cookie if you do this thing that you don't want to do. I try to tell parents you are rewarding poor behavior, so they will continue having that poor behavior. And then you have to up the rewards the more that you're asking them. So how do you feel? We see that all the time, the rewarding of the bad behavior in order to get the behavior to stop.
Yeah, that's a no-no. We do use reward, and you can use what we call artificial reinforcers, which could be cookies, it could even be money and stuff, to reward positive behavior, not to stop behavior, but to reward positive behavior. But even so, you want to do that for a short period of time. If you have a child with ADHD and LD, for example, and they hate homework, I'll reward them. I'll reward them with allowance for doing homework for a while, and then we'll try and phase out the thing. But to do what you're talking about is rewarding the absence or the switch out of a bad behavior by rewarding somebody is not a good idea.
Yes. I'm going to cry. You get a cookie. I cry. I get 2 cookies. And then we continue to do that behavior. And it's correct. And I've seen this over and over in my practice where you reward them because you want them to start maybe doing chores, at 5-year-old, level or something, or giving them some money, they're doing their chores. And then they just do their chores. They just start naturally inhabiting this behavior and it becomes part of their life. So I'd say that a lot to the families, that it doesn't have to be a long period of time or a large reward even, but it can be a short reward to kind of get the train started. And then they just continue the behavior because it becomes natural for them to do.
Exactly. And there's another thing that comes in there that you're implying, I think, and that is that your attention to their good or bad behavior is a powerful, powerful reinforcer. So when you say you're doing money for chores, you do money for chores, what's going to replace it? Two things. One is their satisfaction for doing that chore, and the other is your recognition of what they're doing. That's why, in a sense, when the kids are acting up, it goes back to what you said before, and I crouch down and I get on your level. What's the matter, honey? The kid's crying and whining. I'm reinforcing that. And that really disturbs me because there are so many parenting programs that say this is an emotional moment. You have to talk it over. You have to teach them about emotions. No, I got to teach them how to stop whining. Excuse me. That's it.
Right. Stop the behavior. Exactly. And so how does this framework help parents respond more effectively to behavior compared to the alternatives?
Yeah, well, probably the biggest thing when I say, 1, 2, 3 is only parents talk too much, you don't get into what I call a word trap. And a word trap is a useless discussion. Honey, can I have a candy bar before dinner? No. Why? Because we're eating in 15 minutes. Yeah, but I want one. I just told you can't have one. You never give me anything. What do you mean? You gave my brother 1.5. All right, you're not your brother. Besides, he eats his. And now you're into a word trap, which is, if you listen to my words, what I just said, it's a power play on both sides. It's an emotional power play with the goal to win. It looks like you're negotiating or talking. You're not. I want to win. The kid wants to win, and so on. That's what you avoid with 1, 2, 3 magic. With some of these other ones where you're going to get in there and talk about what does it feel like to be frustrated? Can you tell me what part of your body do you feel the frustration in right now when mommy won't give you the candy bar? Give me a break, And also, we got a mom here. She just finished working all day. She comes home. Now she's going to work all night in what Harley Hochschild calls the second shift. And now she's got to add this to her burden to talk her way out of a word trap with one of her kids? I don't think so.
And I believe that there's one part of your book, I know that you talk about the concept of we shouldn't treat children like little adults. And it's a very popular concept. And that's what we're doing. We're debating with our child. There's another part where you say it's like they're not rising to our level. We're going down to their level. And we're kind of having this bickering argument now with our child when we know what's right and what's wrong. But we're allowing this discussion now to happen, right? So it goes from hierarchical to now here down to that level.
Yeah, and we started it with our initial presentation of a reason. I don't have anything against explanations if they're necessary. But if you have two kids who are fighting and you say that's 1, 2, 3, and they can get the peace time or the timeout or the break time, whatever you want to call it, I think that's a reasonable thing. I don't need to explain to them again why they shouldn't fight. But if I do, and I've just taken the bait and you're in for an unpleasant half hour.
Right. I just explained this to a parent yesterday that if you have 3 or 4 rules in your house, you set the structure, you have a family meeting, you set those rules into place. That's the discussion. And so then they break the rule and you say, okay, so you get a 1 for not listening. Not listening is a household rule. You didn't listen the first time. There doesn't need to be a discussion after that. So one of the phrases I use in my practice is compliance first, talk later. So that's where, again, if you come back at the end and you say, okay, so now what do you think went wrong? What happened? What got in the way of your listening? But this is after the consequence, the timeout. Maybe they have a 10-minute timeout for a 10-year-old. And then if there's any confusion, you clear it up and you expect for the next time, that again was the discussion. Do you agree with that?
I do. I like the compliance first, talk later rather than talk first. Confused everything. Compliance first is what it's about. I don't know if you know Jonathan Haidt, the book, The Anxious Generation.
Yes, I've heard that.
Said his favorite book when his kids were growing up was 1, 2, 3 Magic, because it expects something of the children, which is what? Compliance, the same word you were talking about. And we expect something in the kids and we don't have to explain every single time. If you get into a half-hour word trap with somebody and talk, research shows that's all the time that moms these days have free time during the day is 32 minutes. You just blew your free time.
We don't want to do that. We need that time back.
It's a
Right.
mental health time. Yeah.
Right. Absolutely. I think it's so, so important to understand. And I think it's so much easier that way. I think we're making it harder on ourselves than it needs to be. And so, as we're kind of talking about that with the growing popularity, I guess it would be around maybe 10 years ago, of gentle parenting, how would you compare and contrast that with the approach of 1, 2, 3 magic?
Yeah. As you and I were talking a few minutes ago, I think with gentle parenting, there's different ways of describing it, but I think the focus is on the wrong thing. The focus is on the emotion. The focus should be on the behavior, on the compliance. We can talk about the emotion later if we want to do that. Gentle parenting, I think, is also based on misinterpretations of trauma in kids and what causes trauma. Gentle parenting, the belief is if a kid's upset about something, now if they're upset, that's a different story. They come home and say, my music teacher's an idiot. I'm not going to say that's one. I could say, what happened? If they're upset about me saying it's time for bed, that's a different story. But we don't need to go into that, and talk about it so much. But gentle parenting, I think the philosophy is if my kids are upset, that's a national crisis and I need to intervene. Well, okay, I don't agree with that. And we should talk it over. The other thing I think they believe is the parent should never be the agent of the child's upset. Well, that's what Jonathan Haidt says in The Anxious Generation. It's 1, 2, 3 magic. You have to be the agent because that's what I said at a workshop that I think he went to in the book. And you have to be the agent. You can't give them everything they want. They have to go to bed. They have to do normal. They have to do this. They have to do that, and so on. So you have to frustrate them. And a lot of parents don't accept that. God forbid I should be the person or agent that causes my child's emotional turmoil. Well, you shouldn't become a parent if you feel that way. But that's probably the biggest thing, I think, with the gentle parenting. It's a misinterpretation of life itself, I think.
You think it's not setting them up for hard things, that they're going to, difficulties ahead.
Yeah, I think our parenting these days is setting them up for a life of entitlement. I think we're creating spoiled brats, not necessarily ODD kids all the time, although I think it contributes to the oppositional defiant disorder. But I think we're setting them up to where they see the world as their oyster. And that's not the way it goes. That's not the way it goes. We have child-centered. I think families should be parent-centered. If we talk about dyadic delight, where did this family came from? It came from the dyadic delight of mom and dad. If you look at that family 1 year after people are married or the couple's married or right after they have kids, the parents' relationship is no longer on the list of family priorities. Priorities are mom's job, dad's job, kid 1, kid 2, feed the dog. That's 5 things. The relationship between mom and dad is gone as a priority. And then you say, okay, well, how come we have a 50% divorce rate? That's because mom and dad stopped enjoying each other. They don't have time. They're exhausted.
Bring a really good point up too, because this impacts parenting. And so how important is it in the 1, 2, 3 magic method for both parents to be on the same page?
Exactly. No, you're hitting the nail right on the head. It's absolutely essential. And if you don't have mom and dad delighting in one another and caring, your love for your kids is unconditional. It's biological. Your love for your spouse is conditional. It can go away. And it does go away. You can't trade in your kids, but you can trade in your spouse, and people do. But what do kids want more than anything else? They want a mom who's happy. They want a dad who's happy. And they want mom and dad to be happy together. Kids want that, even though they can't tell you they want the ice cream right now. They don't tell you, I want you guys to be happy and I want you, mom, to be less stressed. But in one survey I saw, that was one of the most frequently mentioned things by children. I want my mother to be happier, to be less stressed.
I hope moms are hearing this right. Know that it matters, taking care of yourself, taking care of your spousal relationship matters so much. And then having that one-on-one time, with your child, and even work comes and goes, but that time with them is very limited while they're young.
I don't think moms today hear that. The least often taken advice is to a mother to take care of yourself. That's almost a no-no for moms. There's almost a competition in moms to be the one who's doing the most for the family, who's the most self-sacrificing and doing. That can mean you're the least happy in your kids.
And they see it and they experience it, right? So that badge of honor, where is that going? If your kiddos see that stress, but yet everything was perfect and the house was tidy and everything was together, but your kids didn't get to enjoy you. So kind of the last question I want to be magic, but what's the balance between empathy and firm boundaries? Because a lot of that, like we said, with gentle parenting comes from this idea that I'm trying to be uber empathetic to my child's difficulties and challenges. And then that kind of comes in the way of setting the boundaries that we need to keep them safe and protected and happy. Because you're right. You said this earlier. Kids aren't going to ask for boundaries. They don't know that they need structure and routine, but they do operate better in those situations, and they feel safer and more protected when they have boundaries and even consequences and limits.
I think the general parenting, I think you said it very well. The emphasis is on empathy.
Mm-hmm.
Yeah, I don't think that's where it should be. The emphasis should be on behavior. How do you know if somebody's emotionally intelligent? By their behavior. You can't crawl inside the brain and see what's going on. But with the general parenting stuff, we emphasize the empathy, and we don't expect so much from our kids. It's okay if you have a tantrum because that's a big feeling. Okay, well, no, I'm sorry. It's inappropriate to have a tantrum, and you can finish it into your room. If you're done, we'll talk later about what happened. But that whole thing in the United States, I just think is going in the wrong direction. Bill Gates is supposed to have said at one point, we're focusing a lot on kids' self-esteem and empathy and that kind of stuff. And somebody told me that Bill Gates once said, your boss doesn't give a damn about your self-esteem. So ask kids to expect that we're heading them down the wrong road.
100%. As soon as they get that first job, it's going to be a shock. It's not going to matter what you feel. It's what you do. What did you accomplish? What did you get done? Right? And this is the safest place for them to try that out. It's the safest place for them to understand and learn these concepts before they go off to a harsher environment.
But empathy is still important. We have in 1, 2, 3 Magic, part of my 2 favorite tactics for bonding are shared one-on-one fun, that dyadic delight, and active listening, or what I call sympathetic listening. And that's what you call the talk later. That's fine. You had a tantrum, you didn't get this and all that, blah, blah, blah. And so we did the signaling, etc. And now later we can talk about it if we want. And that's the time to be empathic. Kids comes home, says, my music teacher's an idiot. It's time for empathy. It sounds like you had a bad day. Tell me what happened. That's empathy. And that's a big part of it. But our priorities are reversed.
Absolutely. Because you're really focusing on when it's a behavior they know they're not supposed to be doing. And you're consequencing that for a variety of reasons. It can be for safety reasons because, they need to know what to do. There's so many reasons to kind of stop that behavior. But saying don't have it, it's just at the appropriate time and place. Because if it's at the beginning, it could be a delay to get what they want versus at the end, it could be a genuine ask, on the other side of the consequence of, so why are things this way? Why do we have to do these things? And that can be a better conversation than at the beginning when you're trying to get them to do what they need to do right away.
Exactly.
And so kind of shifting over to your new book, because I'm excited to hear about The Sound and the Fury, Understanding and Managing Misophonia in Adults and Children. How did your interest in misophonia develop? And for people just that are not familiar with the concept, what is misophonia?
Oh, misophonia is kind of the new kid on the block, I think. And my interest started with it because I have it. I've been diagnosed with it. And looking back on my life, it's been a royal pain for years and years and years. Well, so here's what it is. It's a strange thing. Misophonia is a strong aversion. Miso means hatred and phonia means sound. So it's a strong aversion to certain sounds, usually those associated with eating or with the mouth. So kind of the standard, not jokes, but examples, I should say, are, have you ever been in the movie theater and the person next to you is crunching popcorn? Or you ever been sitting in the movie theater and the person next to you is chewing ice? Or they're chewing ice and crunching popcorn.
Well, that's a tough one.
Yeah. So it's things like that. And it could also be humming. It can be just breathing. It's really strange, but it's certain mouth noises that really get people upset. But I'm talking really upset, as in fight or flight response, a major, major sympathetic nervous system arousal that's similar to panic. It's rage and then often followed by panic. So if you're a misophonic individual like myself and you have one of these episodes, you feel like a real screwball because here you are getting really angry at somebody. Often starts in the family. With me, the start of it was my father eating ice cream at the dinner table. And he wouldn't just eat it. He would slurp it and slop it. And it was a bad thing. But that's what often happens with a lot of people. And if you bring it up and say misophonia, a lot of people don't know what you're talking about. If you give the examples, a lot of people say, yeah, I know what you're talking about. I had that. Or one fellow told me, he said, my boss, every week we have a sales meeting. This guy is a salesman. And we have lunch with my boss and he slurps his soup and it drives me crazy. And we're there for an hour and a half. Well, he can't slurp for 2 hours, but a lot of people know about it. But that's misophonia, and it affects a lot of people's lives because some people are affected so much they can't stay on a job. They can't go out of the house. They can't eat dinner with their family. Can't be with their boyfriend or girlfriend the way they'd like to. So it's a new kid on the block is a strange beast.
Yeah, and I think I first came in contact with just the concept of hearing about the diagnosis maybe 5 or 6 years ago. I started hearing about it, looking it up, kind of hearing more about it. And I'm having some adolescents come in the practice that are saying these things, and the parents are completely confused on it being a thing. So I'm really glad that you're talking about it. I think it's perfectly timed because it has been out for a bit, but we're just, as you're saying, now really coming to understand what it is and how it impacts people. And so, you did already kind of talk about some of the common triggers and some emotional reactions, but how does it kind of impact daily functioning mental health for the people that have misophonia?
Well, for the people that have misophonia, you got two problems. Your first problem is, as you mentioned, they call the trigger, is how often during the day am I presented with triggers? So imagine you go to work and you're in a cubicle and the person in the cubicle next to you does in fact hum and chew ice at the same time. And you're there 8 hours a day next to this other individual. That's one thing, as opposed to the salesman who once a week has got to be with the boss who's slurping soup. You have misophonic ranges here where some people are just clobbered with it for hours and hours and hours. They go to work and then maybe eat dinner with their family and so on. And other people are not so much affected. But any individual who has those reactions, that's the first reaction, is the misophonic trigger and my reaction to it. The second one is, since our human brains just love to sit around and reflect and think, the second reaction is, now that I've had this reaction, what does that say about me? Maybe it says that I'm a nut. Maybe it says that I'm a screwball. Maybe it says I'm not really part of the human race. I was enraged with another innocent human being who, without any maliciousness whatsoever, drove me crazy. What does that say about me? And what's my life going to be like if I have to deal with that? So for the misophonic individual, their mental health is attacked in two ways: the immediate triggers, and then the aftermath, the reflecting, and the drop in self-esteem.
And what do you think are some of the common misconceptions about misophonia? For some people who say it's not real, I've heard parents say that doesn't exist, she's making it up, she's being dramatic. I've heard that a couple of times. And so what are some misconceptions you'd like to address?
Yeah, well, one of the misconceptions, kind of what you're talking about, and that's that the person is making it up. This is so screwy that you couldn't possibly think that way. Well, okay, now that makes me feel screwier, but it also makes me angrier because people think that it can't be real. You've got to have some malicious motive yourself in reacting to the triggers the way you do. And this whole thing is just so stupid that it doesn't exist. There's other people that say, too, there's kind of a perception of mental health in the United States that we will diagnose anything that pops up that seems a little bit disturbing or whatever. That's the good old U.S. We're going to put it in the DSM-6 and so on. So that reinforces the idea that it's a manufactured diagnosis, but it's not. If you talk to people who have experienced misophonic reactions, they are overwhelmed with it.
I've had some pretty intense reactions, anxiety reactions. So sometimes it can be like anger and rage. And one teenager that I worked with, she became very, very anxious at the dinner table. And it was like she felt like she was hearing things that nobody else was hearing. It's like it was so loud to her that she wasn't sure if she should leave the table. She wanted to still have family dinner. So it was a very real stressor and anxiety inducer for her because she didn't want to have that. She didn't want to leave the table. She didn't want to get upset at her family. Some of the things that you're talking about.
You're bringing up a very important point, and that's the anger anxiety sequence with misophonia. Because usually hers is a little different, but what often happens is you'll have the trigger and you're enraged by the trigger. But because the trigger is a social thing, it's another person doing it, not a hippopotamus or a rock hitting the ground. It's another person doing it. Your next thing is, what if somebody notices my reaction? And so your next is kind of a social anxiety panic. Are they going to see me as a real screwball or whatever? Because I am this enraged by this thing that's so stupid. So we get that anger panic sequence. And because anger and anxiety, the fight or flight response, look at it, fight, flight, anger, anxiety, it's the same reaction in your body. So you're all prepped. You're ready to go. Your panic attack, rage, call it what you want. Your heart's pounding, you're sweating, your muscles are tense in both. That's the sympathetic nervous system doing its thing, which our society loves to do. We don't like calm, peace, and relaxation. We like sympathetic nervous, panic, emotional
Activation. All the time. And so, as we're talking about the coping part of this, and your book, again, The Sound and the Fury, which I love the title, The Sound and the Fury. Oh, I think that's a great title. It stopped me in my tracks when you said that to me. Like, that's a really great title, The Fury.
Fury it is. And that's borrowing a little from Shakespeare and I think Tennessee Vibes.
Oh, it's great. I love that title. So what are some of the coping tools or therapeutic strategies that you found most helpful for individuals with misophonia?
The first one, by far the most important, is what I call permission and acceptance. And that means you have to give yourself permission to have misophonia and not to think of it as the worst thing in the world or that makes you not part of the human race or whatever. So you got to give yourself permission to, okay, I've got misophonia. Too bad. That's what happened. A lot of people don't have it. I have it. Okay, tough break. But now my next thing is, what am I going to do with it? And there are several things that you can help. One is you can avoid trigger. So if you go to the show and people do their stuff next to you and all that, you can not go to the show. You can wait till the thing comes out on streaming. However, if you have a trigger, the girl in the next cubicle at work, we can't just say you can't go to work. You have to do something. So avoidance of triggers is legitimate if it doesn't screw up your whole life and restrict you. The other thing you can do, we do cognitive behavior therapy with misophonic. And I'll just give you one example. In CBT, as you know, you're going to change your thoughts to change your feelings and behavior. One of the strongest thoughts with misophonia, other person is innocent of wrongdoing. They're probably a sympathetic, compassionate person. And if they knew what they were doing to you, they'd be horrified. But you have to take the responsibility. This is your problem. You're causing it. That person isn't causing it. You're causing it. So we have to make thought adjustments. So permission, thought adjustment leads on to the next one. And you can do exposure treatments with misophonia, which I did with some of my stuff. And with exposure, they're very careful about saying you don't want to expose yourself repeatedly to a severe trigger because it'll make the thing worse. But if you have like what I had, the sound of people chewing with their mouth open, you can go on the internet and find a site. I call her my potato chip girl, and I watch her chew potato chips. And I can turn up and down the volume, and I can do it for just 30 seconds at a time. But before I do that, I get myself relaxed, and then I turn her up. And that's exposure therapy. It's almost what Joseph Wolpe, if you recall, did systematic desensitization.
Yeah,
it's like
exactly.
That. Yeah. And I also think I'm a little bit of a renegade here. I think in the misophonia crowd, I also think there's some medications that could help a lot. In particular, the beta blockers. And I don't know if you know much about beta blockers, but you know that about 70% of professional musicians have tried beta blocker.
I did not know that.
Yeah, because a beta blocker is anti-sympathetic arousal. It's an anti-fight or flight response. You're going to play the violin well. You can't be having a panic attack while you're playing the violin. And there's some research that indicates that the beta blockers may help along with all this other stuff. So it's permission and acceptance, cognitive behavior therapy, exposure, relaxation training, and possibly for some people, medication.
Okay. Yes. And so you wouldn't recommend that everybody else around them changes their behavior in order to help them. That's some of the things that I've heard from people, even parents that have had it. They try to change the environment in order to help themselves. And what I try to tell them, that's not real life. That's not realistic. We're not able to do that at restaurants. We're not able to do that when we're out and about or with other people enjoying their company. So we have to be aware and then start to develop, like you said, those coping strategies to then maybe go into those places. Correct? Like that's the better order of things.
We can, yeah. And you're bringing up an interesting point here because if that trigger, eating dinner with the family, is severe, I don't want them in that. But if we all accept the fact of the misophonia, maybe they can go in that and wear earphones or no, just a little bit of white noise or music or whatever. We allow them to do that because They didn't ask for the misophonia, and we didn't ask for it either. So we're going to make some adjustment to do that. You bring up another point, and that is if you're in a family, wherever you are with misophonia, you have the problem of explaining it to everybody else and enlisting their support cooperation, which is absolutely critical because you feel so funny to begin with about the problem. And other people can be really, really helpful or really, really a problem when it comes to dealing with it.
So what I'm really hearing is it's very similar to other diagnoses that we already know exist. Some people don't understand the anxiety that somebody else is going through because they don't have it themselves. But if you care about the individual, you learn about their triggers and how it impacts them to be able to help and support them. But you can't take away the anxiety. You can just kind of help and support them through it and give them the skills to cope with it. But it doesn't mean you're always going to understand it.
That's right. You won't know what it feels like. As you say, you give them the benefit of the doubt that this is a legitimate thing, and we'll work together to deal with it as best we can.
Mm-hmm. And on that note, what role does emotional regulation play in helping manage some of the more intense reactions that people have?
Yeah. We get into emotional regulation. We get into something that is a big problem for us therapists. Research shows when we recommend relaxation training, about nobody does it.
Mm-hmm.
Like I said, our society is geared toward emotional over-arousal. Who ever heard of relaxation? I don't have time to relax and stuff.
I think if I had a nickel for every time I heard breathing doesn't work, I'd be a very wealthy woman at this point.
That's right. So I ask people, maybe you do too, for emotional regulation, I want you to find your best relaxation technique. Have you ever tried anything that helped? Was it breathing? Was it exercise? What was it? Because we need your parasympathetic relaxer nervous system to kick in and get you relaxed. And we need to train you to do that, not only for misophonia, but it's a nice way to live. We don't need to be excited all the time. So emotional regulation gets us smack dab, us therapists, into this non-compliance with relaxation training problem. And I tell people, it may not be the most fun thing in the world, but whenever I've done it during a day, if I get myself to sit down and do a 15 minutes meditation or whatever, I am always, 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 always glad I did it afterwards.
I agree. I have a 10-minute kind of reset that I do just even here in my office in the middle of the day. If I've had a really busy day, I never regret it. I just don't regret giving back those 10 minutes to myself because it makes the rest of the day better. But I just had to stop and force just a few minutes to take care of myself and to calm down.
And if we go back for a second to our moms with parenting and 1, 2, 3 magic, moms need the same thing. Maybe that's when you do, because moms need the same thing. And they say, I don't have enough time. Yes, you do. Let's just try it and see how you feel afterwards.
Right. Absolutely. I think we can all find 10 to 15 minutes every few hours in our day. It's just what are we doing with that time that we do have set aside? And so what message do you think of hope or encouragement would you like to offer to families that are facing parenting challenges today? It could be misophonia related. It could be behavior related. But what would you like to tell parents that are struggling out there? Because I do think there's so many mixed messages on what good parenting looks like these days. I genuinely have parents that come in confused all the time. And so that's one of the reasons why I personally recommend your book to every single family that comes in, either the 2 through 12 version, or I also let people know there's a teen version as well. And I like the book that explains it for kids to kids. I usually go over the first and second chapter with my kiddos in session whenever I'm recommending it to their parents and let them know I'm the one that started this if you want to be upset at someone. But there's just a lot of confusing and mixed messages on parenting out there, and even just bonding with your children, what time should look like. So what do you think about giving them a message of hope or encouragement during these times of challenge?
I would say, number one, it is possible to do it. That's why 1, 2, 3 Magic exists. And there are other parenting programs, and some people like another one. But I would say for parents, I'm going to ask you to start in a place that you may think is not possible or even doesn't exist. And that is, I would ask you to start by putting the relationship between mom and dad back on the map. It's gone. It's not on the list top 5. It's not there. Your kids need you to be happy. And then let's ask the both of you the question, what kind of parents do you want to be? But can we get you both back into some appreciation of one another, some dyadic delight? That's where your relationship was born.
can we go back there?
I love that concept. I love the dyadic delight concept and how you really outlined it for both the couple and then also an individual and their child. It's a great place to kind of land the plane just because I think the messaging of just go and spend some time with your kiddos, spend some time with your spouse, take them out on date night, read this book together. I always tell people, hey, you know what? There's audio versions out there. So if I can't read a book, I don't have time, listen to the audio version. If you like the physical book, get the physical version. But if you can get on the same page with it, that will help your spouse, will help your family. And so thank you for all of the work that you have done. Thank you for all the lives that you have changed. Thank you for personally helping me in my practice, since I got started way back when, and even for my own child. So I just appreciate all the work that you've done, the success that you've had. Just congratulations on your career. And thank you so much for coming in and talking with me today.
Thanks for having me.
Yes, I really and truly have appreciated this time. So thank you so much. And I hope you join us next time on Mental Health Without Borders.